So we come now to the final section of this module, and I wanted to just summarize the evaluation procedures. I have been able over the 18 modules to gain some kind of idea of how each participant is placed with regard to the skills required for the path method counseling, and have realized that there are three levels at which one can practice this work and also evaluate your standards. The one is your personal processing, in other words, self-processing with yourself. And I think everyone has that capacity now. The second is the practice with family or friends, people that you know and that you are working, living with even. And this is the second level of competency that some are ready to engage in. And the third is the professional level, the level with patients and with clients and so on. And this is again another step up. So in order to evaluate where each person is in their progress towards becoming master counselors, I have, number one, my own appraisals throughout the module. Secondly, we have the assignment, the thesis, because this thesis will give me certainly an idea of certain competencies. Not only are you actually going to be practicing a process of yours, working with yourself, of course, but you're also going to be organizing a whole journey of let's say, witnessing or observing oneself. And one's going to develop it through these different stages of a research question, hypothesis, an introduction, a method description, a collection of data, your own path process, and then the analysis and discussion of what you have attained through the processing of using the path method, and then finally concluding and making a short abstract summary of the whole of this research project. This will give me a lot of information as to how you are disciplined, how you are able to construct a storyline, and of course how you are professionally equipped to take this work into the world. And that's the second level. The third is, I hope that you will be able to do a video recording of whichever level you feel that you are competent to carry out. So if you are feeling you're only competent to work with yourself, you will do a video of yourself in process. If you feel that you are competent to work with a person, child, then that will enable, you will be able to video that with permission from your client. And of course, the third is, will you find a patient who would be prepared to be on video for my personal evaluation. This may not be possible, but we will see what can be done in that regard. So the next step towards evaluating will be a personal interview. Once everyone has completed their thesis and their videoing, and also I've got an overall assessment, we will have an individual discussion interview where together we will assess at what level you are. And on that basis, the accreditation will take place. We're hoping to do that towards the end of July. Our dates currently will be either the 19th of July or the 26th of July. Probably the 26th, which will enable most people to be present. I'd prefer that it didn't go into the first week of August. So that is now a completion of Module 18. I know that we're not at the end of our work. We will still continue to work on the WhatsApp videos in this next, and of course the thesis. We will have a Zoom conference on the 29th of June, and it will lead into July to do the final evaluation. And then a celebration at the end of July, as I said, where we will do a graduation, and we will also want to inaugurate the Path Method Therapy Association and the Path to Health Academy of Learning, a whole person, whole world learning program. So that's it for today. I wish you well and send you all my love and gratitude and blessings for a good start ahead. And we will be continuing to meet on the WhatsApp videos. So all the best and much, much love to all. Thank you.